blood pressure is known that you are rather high or low. We are doing how to manage it, not to fall a victim of this. So we are doing all this to encourage people to undergo their health practitioners to find out more about their health and also reduce the laws when it comes to the individual countries.
So taught how to handle all these issues. What's the name of this?
This is called agriculture.
Fantastic. You have done the job. Great.
To add up to what she said, here your blood is tested, your blood pressure is tested. If that is also be tested. So if you are ready, they could test you.
I don't test me.
Yes.
I don't put my finger.
Just a little bit.
Just a little bit.
You can have
With this on, I have to skip this. But it has to be on the skin, right?
Right, the name,
So you can ask from there.
so please say good afternoon. Please, may I know your name officially? So we are about to check for the amount of glucose in your body right now. So please, if I may ask, have you eaten this morning?
Yes, please.
Okay. So since you have eaten, the figures that we will get won't be the same as a person who has been eating. So we kindly educate you that when you go to the hospital and then someone is having small figures and you're having big figures, you shouldn't panic because maybe the person hasn't eaten and you have already eaten. So, please can you trust me in your hair for some seconds? So, first we'll have to check for a place that can break and then we get now blood. So I think this is, so we need to disinfect the place so that there won't be error. We are checking for
the content. The woman I'm sure. They come and ask
So this is the glucometer as well. Since you are a doctor, and this is the so to all those who are here, when you go to the hospital and the lancet is like this, you need to know that it's not used. So this is how it is. When the lancet is not used, so So since they are checking for the blood, I would like to talk about this lancet a little bit. So when you go to the hospital and then the lancet has been positioned like this, that means the lancet has already been used. So this is how it is when it's used. So in case if you go to the hospital and the doctor or the nurse mistakenly trying to use this lancet, you should let the person know that you know that the lancet has been used. So he or she should use the lancet. So say this is your glucose level, the amount of glucose you have. That means since you have eaten it normal. So I should have 4.1 mmol.
Okay, thank you.
It takes some time before the
You're right. Congratulations. I'm proud of you. It's going away.
So now blood we have antigen A and we have antigen B. So these are antibodies A, B, and C. The antibody A will be placed here and the antibody B will be placed here and the antibody B will be placed here. So since here and here didn't clot, it means his blood doesn't contain antigen A and antigen B, but it contains the rhesus factor, which means he is positive.
So if you don't have A, you don't have B, you are O.
But if you have A and B, you are AB.
You have only A, you are A. You have only B, you are B. You don't have the resource factor. You are
Negative.
females who are negative and they marry someone who is positive. Their first delivery there will be no problem. By their second delivery, you have to go for what we call yoga. Otherwise, you will have complications. It's compulsory for all pregnant women to know their blood. That if they are negative, especially, you have to know that of your husband. If your husband is positive, you have to be careful with your skin. So I'm proud of you. There will be a medical training on Thursday. If you get a chance, you can join with the other professionals and you learn more. Even as you judge the doctors. Okay?
We are done with the medical session. I would like to introduce you. So, for robotic session, I would like to complete it, and I would like one volunteer or someone.
So any money at all. Yes.
Chief of Branty. You want me to do what?
So having the assumption that he is the right person, so there is an obstacle in front of him. So with just practical issues, maybe just 15 centimeters, but you can increase it to any extent that you want. They can see when I bring my hand, you can hear a beep sound, telling the blind individual that there is an obstacle in front of the person, so the person needs to change his or her direction. We are also building a chatbot whereby the blind individual can ask the chatbot questions, like where am I right now? The chatbot can say that you are to enter a sample or yes, so you can interact with the chatbot. So thank you.
Wow. I'm impressed.
Yes, so this is the smart
So improvement on that, see if you can get an earpiece to connect to it.
Yes.
So that you can get and then whilst you have that communication without an external person.
Thank you, sir. So I would like to talk more also about our smart car. So she said it can be controlled using our remote. So we built an app for it whereby it can be controlled. So you can see right now she's controlling it through the car, through the app. And you can also make it manual, such a case that when the smart car also sees an obstacle, it will change the direction. So you can see that right now it's sensing that there are obstacles in a situation whereby it will prevent accident. So when you are having a sensor like this in your car, you'll be driving your car alright, but in case when you are riding your car in the small hill or there is a track that automatically or first of all comes in front of you, the car will change the direction automatically. And this is not only what the car can do, the car can also track individuals. So
So this part, we made it for the security agency like the police and I'll say the military. In a situation whereby the military and well, they know where they are. You can just use the individual facial recognition on the code, when you create the code, and then how will just be moving around, and how will you where the person is, and show you where you can find the person. So this tool is a smartphone. Mostly in Ghana, places like Accra and Kumasi, when it rains heavy, we normally have flooding on our bridges and sometimes our road. So when this system, when it says that it's raining and the water level that's in normal place is rising, then the bridge will automatically rise up. This one too is a normal sample of this car that we did, but this one too is special on its own in the sense that it has some line tracking abilities. So you can tell it that it should only track white lines, then it will track only specifically for program. Because when you go to programs, people normally don't go to the ground. So you can make lines on the ground whereby the robot will have a dashboard on top of it and moving through the line and it should take in the keys of the individual. So these are the figures that
and I'm proud of you. It's been working hard to see all the support you
So, madam, with your kind permission, can we take a group
For our gallery.